A healthcare disparity existed well before this pandemic hit. This virus illustrated just how much work we have to do to ensure our communities can be protected with access to meaningful healthcare. Now, in New York, where the virus was particularly devastating, Black residents were twice as likely to die from COVID 19 as whites. We don't have similar statistics in Pennsylvania right now because our State Department had only started collecting race based data in May. The color of one's skin should not be a barrier to quality care. And it's critical that we understand this issue and its causes. Our next testifier is Dr. Camen Guerra, Associate Director of Diversity of Outreach, Hospital of University of Pennsylvania.
My name is Dr. Camen Guerra, and I am a physician and an associate professor at the University of Pennsylvania School of Medicine, and also a senior fellow at the Leonard Davis Institute of Health Economics. At Penn, what I do is I study health inequities, and I design and implement and evaluate programs and strategies that help to eliminate health disparities, usually by working with communities. And it is truly an honor and a pleasure to offer some policy approaches to reducing the COVID-19 racial disparities that we have all witnessed and that which have affected deeply our communities in Pennsylvania. In Philadelphia, you have heard the statistics from prior speakers. There has been a disproportionate impact on Black communities by COVID-19. And that is the most important reason we are here today, to try to look at potential themes. We know that these social determinants of health, plus the physical environment, plus behaviors, actually explain 80% of health outcomes. And what we do, many of us here today that are from health systems, what we do only contributes 20 to 20% of the health outcomes. So it's going to be critically important to recognize that if we are going to have an impact on the COVID-19 disparities, that we actually have to take a closer look at the social determinants of health, which I think you've been hearing throughout this morning. And that means looking at where people live and where people work, and looking at the types of jobs that they have. Many of them, as you already heard, are essential workers. And how can we protect them? How can we advocate for paid sick leave and safer working conditions so that they aren't exposed? And if they are exposed, they can take the time to seek the proper medical care and not return to work where they might be exposing other individuals. I also want to draw attention to, in addition to safer working conditions, the access to care issue, which is where we can be potentially most helpful here on this call. As you've heard, the access to testing has not been equitable. And in our own city of Philadelphia, we have noted that access to tests have been inequitable by zip code. There's a zip code 19102 in Philadelphia where the median income is $90,000, and the testing rate there is 16 per thousand. And yet in North Philadelphia 19120, where the median income is $37,000, the testing rate was only 2.7 per 100,000. So this unequal access to COVID-19 testing can set us up again if there are future waves of COVID-19 to deepening the disparities that we're seeing. And so one of the things that I'd like to propose to help this important committee with is thinking, how do we close the gap on those geographic inequities that exist among the neighborhoods mostly occupied by Black communities? And what I would propose is that we actually have many of the resources already in our health systems. You have already been hearing about those centers, for example, people who are experts in health equity that can come together and solve these issues. And potentially one important way is to work with our community, for example, the Black churches that have served as beacons of hope and as allies in helping us serve the social needs of our Black communities. Those Black church leaders that can be our partners are also willing to do so. They care about their communities and these disparities. And then our citizens also trust those individuals and those leaders. Dr. Ala Stanford at Jefferson Abington Hospital has already been demonstrating that this can be done. And one potential solution is that in addition to partnering with our Black churches, is to provide more mobile testing units. There are individuals that, even though they may be affiliated with a church, may not have the ability to access transportation and come to any kind of testing events. And so I put forth the fact that many of the health systems actually have mobile testing capacity already for other things. I have a colleague in the emergency medicine department named Dr. Benabella, who's using mobile CPR training, who's ready and willing to redeploy his resources to increase access to testing. And then finally, I want to just point to the future. I'm going to be honest and tell you that I am very nervous and fearful that these disparities will only deepen, because as I've watched health systems across this country embrace the role of telemedicine, the digital divide in our country is becoming clearer and clearer. And I believe that this access to broadband is going to become an important social determinant of health, and that will dictate our patient experiences and potentially create for more disparities. And here we have an opportunity, perhaps by joining with the Department of Education, which has the mutual goal of expanding broadband access to Pennsylvania residents, for helping our students to learn. And perhaps we can partner with them on the shared mutual goal of expanding broadband to provide platforms for telehealth for our families. And finally, my last concern is that I am worried that once a vaccine does become available, that again, we will see inequitable access to vaccines. We have staff and experiences in the community that already tell us there's actually misinformation already circulating that makes many of our Black residents fearful of a vaccine, mistrustful of a vaccine. And so I think we need to prepare for that, and with really accurate information and ways of disseminating that information through people that we trust. And then once a vaccine does become available, by establishing policies that provide for free cost vaccines. So with that, I'd like to end with a thank you again for your invitation to participate. And I stand ready to help and work with you to eliminate the COVID-19 disparities. Thank you.
You've already helped. I mean, I'm taking down some of these notes about telemedicine that I never even thought of, and then the vaccine policy. So you're already helping, believe me.